Cognitive and Emotional Impairments by Carolee, Jessica, Julie, and Lexi. The cognitive and emotional impairments included in this presentation are intellectual disabilities, autism, attention deficit hyperactivity disorder, chronic anxiety and/or depression, and post-traumatic stress disorder. Media portrayal of people with impairments can be accurate, but sometimes they are inaccurate and hurtful. Cognitive and Emotional Impairments by Carolee, Jessica, Julie, and Lexi. The cognitive and emotional impairments included in this presentation are people with intellectual disabilities, autism, attention deficit hyperactivity disorder, chronic anxiety and/or depression, or post-traumatic stress disorder. Media portrayal of people with impairments can be accurate, but sometimes they are inaccurate and hurtful. These impairments are portrayed in many forms of media: books, artwork, music, and movies. Sometimes the creators get them right. Sometimes they don't. Sometimes they are seen as heroic and resilient, like in Forrest Gump. Sometimes they are portrayed as evil, fractured, and skewed, like in Silence of the Lambs and Psycho. Common misrepresentations in the media include: they look different, they are violent, they never recover. All mental illnesses are the same and are extreme, and mental hospitals are evil. And unfortunately, most people get their information about mental impairments from the media. The definition of family means a group of two or more people with close and enduring emotional ties. The role of family in a person's recovery cannot be overemphasized. Families are a source of trust. They encourage health promotion activities. They recognize the emotional and physical stress of their loved one, and they provide a connection to society, and they bridge the gap between the individual and the medical providers. Peers can influence vulnerable populations for good or for bad. They can encourage continued treatment, promote healthy decisions, connect persons to community and friend groups, decrease risks of relapse. They can also promote unhealthy behaviors or contribute to poor coping mechanisms and be abusive. Nobody knows the exact cause or causes of behavioral or emotional disturbance, although several factors have been suggested and vigorously researched. What we do know is that these behaviors and emotional disturbances can be multifactorial. Genetically, there can be familial links to anxiety, depression, ADD, ADHD, autism, and low IQ. And environmentally, drugs, alcohol, smoking, and then other chemicals such as pollution and radiation and also malnourishment can have an effect. And then also learned behavior by way of healthy or unhealthy coping mechanisms, habits, and self-care. In the legal and political system, there are some strong points for these people. There are multiple helplines, both local, state, and national. There's a wide variety of treatment centers and therapists available. There are multiple government-supported programs, and there are stable programs for children. However, the points that are lacking is that the education on available resources and programs is not quite comprehensive enough. And then the public education is also not comprehensive enough with regards to mental illness in general. And then continued care coordination for adults once they move past the stages of childhood are not as useful or helpful, I should say. There needs to be more help in that regard. And then the funding is a problem after that. Some of the potential barriers are poor transition into society, which we discussed on the prior slide. It can be very discouraging. And then lack of coordination of care and resources. Sometimes there's significant amounts of paperwork and waiting lists and times, which can be very discouraging. And then a shortage of qualified providers. So we talked about having providers on this prior slide, wide variety of treatment centers and therapists available. But the wide variety does not necessarily mean that there's an over amount of qualified providers. So there's still a shortage. And then language barriers can be an issue also. And then lack of transportation to care and treatment places or appointments. Okay. let's see here. So religious beliefs, cultural environment of this population is greatly influenced by this, and their care and their support is greatly influenced also. For example, due to their beliefs, the Muslim practices only allow women to receive care from female providers. Also, for those following a stricter Muslim practice, the women must receive permission from the male head of the family in order to receive care. The cultural perceptions of this population towards mental health is also hard, because in some, for example, Muslim cultures, again, mental health problems are seen as a stigma of a problem punishable by God. Therefore, they lack the support system that is so needed. Along with the lack of a support system, this population is not always aware that they need help. For those who are aware, they do not always know how to access this help. And then also illegal status is another factor that may prevent this population from reaching out and or being able to access available services. Data and information regarding the family environment and a child's potential delays were gathered. So in the family environment, things that were measured are income, number of children, the learning resources available. This involves things such as books and toys, and then also the support for learning, which is any support that the child would receive that helps them to develop mentally, such as reading books together, looking at picture books, telling stories, singing songs, the caregiver playing with the child, naming, counting, drawing. And then the potential delays that they discovered were in communication, and then in gross motor skills and fine motor skills and problem-solving skills and personal and social interactions. And a lack of toys or insufficient learning activities increased the prevalence of developmental delays for these children. There's some interesting statistics there. So it's actually difficult to find specific statistics and information in relation to socioeconomic status and emotional and cognitive impairment, but what we could find is in these boxes. So image 1 is from the CDC. It shows the economic cost of having an autistic child or developmentally delayed child, and that poverty would put this child at greater risk for lack of sufficient health care. Image 2 is the cost of depression, and study shows that the cost of care has increased significantly in the last 20 years. And with depression being the 6th most costly health condition, this could place individuals at risk for lack of care related to their socioeconomic status. And then the cost of ADHD, this is a comprehensive study, and it shows not only the annual cost, but shows other economic costs related to having ADHD, such as being more accident prone and having additional mental health challenges. And then also it increases the annual cost because many adults with ADHD struggle sustaining an occupation to support direct and indirect treatment. This leaves these individuals in poverty and at risk. This isn't all ADHD adults. This is just some of the challenges that they can face. It's projected that by 2044, more than half of the U.S. population will belong to a minority group. Most racial ethnic minority groups overall have similar or fewer mental disorders than white people. And white Americans are more likely to die by suicide than other ethnic groups. And then lack of cultural understanding can lead to a related misdiagnosis. And finally, people from ethnic minorities are less likely to receive mental health care. So with the health disparities with regards to race and ethnicity, the barriers to treatment that they face are the lack of insurance. Sometimes their mental illness will be the barrier in and of itself. And then a stigma about the mental illness can cause a barrier. And then lack of culturally competent or diverse providers can be an issue. And again, we've got language barriers here. And then an overall distrust in the healthcare system. Generally speaking. This is a chart that shows the prevalence of autism in 4 different cultures, and the highest one being the non-Hispanic white culture, which I thought was really interesting. Psychiatry has long frowned upon the mental health effects of religion, relating to the idea that religion is guilt-inducing. But for many people, religion is a way to cope with stress. And it's associated with feeling hopeful and having meaning in life and greater self-esteem and feeling optimistic and feeling satisfied with life. A comprehensive analysis of 70 studies show that 56% reported that those who are more religious have lower levels of depression and respond faster to treatment. This is a chart showing the overall prevalence of autism between boys and girls, and as you can see here, 1 girl for every 4 boys was identified with having autism. So it's an interesting ratio. Okay, health disparities with regards to gender. Adolescent girls, they struggle with depression and eating disorders and suicidal ideation and attempts. Whereas adolescent boys, they have anger management issues sometimes, and they are at higher risk for doing high-risk behaviors. They choose to do high-risk behaviors. I say that differently. And then adult women, they struggle with depression and anxiety. And adult men, they turn to substance use, and they have substance use disorders. And the contributing factors have everything to do with hormonal changes amongst all the adolescent kids and adults. And then gender roles and gender-based violence. And this slide is just a continuation of the last, just some interesting statistics, ratio of male to female in the use of mood stabilizing drugs. Anyway, just kind of an interesting topic there. And then with regards to health disparities and geographic location, so those that choose to live outside of city limits have very limited access to health care, which can prevent them from getting the help they need. And so there's telehealth and telemedicine, and it's a convenient resource since it's open 24 hours a day, every day of the year. And it has reasonable fees, and it can be accessed from any location, and even better, you don't need an appointment. So healthcare professionals can provide services to this population through therapy, prescriptions, and referrals. And while this can be a good way to connect with a professional without having to commute, telehealth and telemedicine is not for emergency situations. Biases. So studies have shown there is a great deal of variability regarding the mental illness stigma among the general public. So participants' implicit beliefs or unconscious beliefs are that people with mental illnesses are bad and helpless and blameworthy, as compared to people with physical illness, whereas people with explicit or conscious beliefs they believe that people with mental illnesses are bad and helpless, but not blameworthy. Research shows that more exposure to people with mental illness actually decreases these barriers and stigma towards those with mental illnesses. So, according to the World Health Organization, the United States ranks 3rd when measuring countries faced with the burden of mental health and behavioral disorders worldwide. A statistic that's determined by the years of lives lost to mental disability and death rates of those with mental illnesses. There's an alarming amount of improvements that need to be made about to the mental health care system in the U.S., but mental health is a global issue that pervades all countries and cultures. Depression is the leading cause of disability worldwide, and despite that fact, many countries still do not actively prioritize mental health care. Countries that have the best mental health coverage seem to have the least problems with it affecting their physical health. Norway is one of the leading countries for comprehensive mental health care, providing mentally ill citizens with an abundance of inpatient and outpatient resources. In Argentina, seeking counseling and visiting a psychologist is commonplace, unlike other countries that view the mental health and treatment in mental illness as taboo. So it's very destigmatized in Argentina, and it has the highest amount of psychologists per capita in the world. Anyway, some interesting information. We hope that you've enjoyed this presentation, and here are our references, and thank you so much for your time.